Artificial tears is used to relieve dry, irritated eyes. Common causes for dry eyes include wind, sun, heat and air conditioning, computer use, reading, and certain medications. This product may contain one or more of the following ingredients: carboxymethylcellulose, dextrin, glycerin, hypermylose, polyethylene glycol 400, polysorbate, polyvinyl alcohol, povidone or propylene glycol, amonazes. Eye lubricants keep the eye moist, helps to protect the eye from injury and infection, and decrease symptoms of dry eyes such as burning, itching, and feeling as if something is in the eye. Indications: artificial tears are used to protect and lubricate mucous membranes and relieve eye dryness and irritation. How to use. This medicine is only for use in the eye, do not take by mouth. Follow the directions on the label, wash hands before and after use. Tilt the head back slightly and pull down the lower eyelids with your index finger to form a pouch. Try not to touch the tip of the dropper to your eye, fingertips or any other surface. Squeeze the prescribed number of drops, usually 1 or 2 drops, into the patch. Close the jar gently for a few moments to allow the drops to be in contact with the eye. Use your medicine at regular intervals. Do not use your medicine more often than directed. Talk to a pediatrician regarding the use of this medicine in children. While this medicine may be used in children as young as 6 years for selected conditions, precautions do apply. Medicine. You should not use an artificial tears if you are allergic to it. This medicine will not treat or prevent an eye infection. Ask a doctor or pharmacist if it is safe for you to use artificial tears if you have any type of infection in your eye. Tell a doctor if you are pregnant or breastfeeding. Precautions. If you experience eye pain, changes in vision, continued redness or irritation of the eye, or if your eye condition gets worse or lasts longer than 72 hours, discontinue use and consult a healthcare professional. To avoid contamination of this product, do not touch the tip of the container to any surface. Do not share this medicine with others. If the product changes color or becomes cloudy, do not use. If you wear contact lenses, you should remove them before putting the drops in your eyes. Wait at least 15 minutes after putting the drops in your eyes before putting your contact lenses back in. Side effects. Side effects of artificial tears can include blurred vision, eye pain, headache, itching, stinging, redness in and around the eyes, skin rash, crusting of eyelids.